Hey everybody, Dr. Eric Plasker here. Welcome to 100 Year Lifestyle TV. And oh yes, I'm here with a great friend, South Florida's one of their best chiropractors, maybe the best chiropractor, come on.
Yeah, the best.
Dr. Aixa Goodrich, and so nice to be with you in your neck of the woods.
Thank you, yeah, I'm so glad to have you back.
Yeah, well, it's awesome, and you're doing such a great job, and this is kind of fun for me because Dr. Goodrich, you probably know, she's got a show that she does called Manifest Your Epic Life, and she's one of our 100 Year Lifestyle affiliates, and I've been on your show, but now I get to interview you.
Awesome.
Yeah,
so cool. Thank you.
Very cool. So I said you're the best chiropractor, and I do believe that that's true. And talk about a little bit about the people that you see and the people that you work with, because I think it's very different than what a lot of our audience may be thinking.
I work with a range of patients, from newborns all the way up to their senior, most mature patient that you can think of. And I believe in providing my patients lifestyle care. Chiropractic is for everyone from the time they're born to the time that they transition over to the next phase of life, right?
And so when you say that it's for everyone, I mean, I know that certainly my children have been getting checked since birth. A lot of our patients, same thing. Many people don't understand why, because there's a lot of misinformation and there's a lot of, I think, marketing and advertising out there that confuses the public as to the benefits of chiropractic care. So talk about why people in all stages of life get checked.
Perfect. Well, the first thing we need to understand is that the nervous system is what controls and coordinates everything that happens in the body. And the nervous system is made up of the brain, the spinal cord, and the nerves, as you very well know, which go to all the organs, tissues, and cells in your body. And so if that's the primary control system that controls everything in your body, then we need to make sure that there's no interference. So chiropractic is not about neck pain or back pain or you were in an accident, even though we can treat those as well, right?
And it works great.
And it works great. And it doesn't have any side effects, great side effects actually, right?
Yeah, the side effects, right? Somebody comes, yeah, doc, my neck is better, but so are my allergies, and you didn't even treat that. And I think that's an important component because people say, well, you treat this. But it's not really about the treating of the condition, it's about the caring of the spine and the nervous system.
Exactly. So we clear the interference and the body does what it does best, which is self-heal and self-regulate. And that's what we teach our patients, that their body is self-healing and self-regulating. And I just clear the pathway and their body does what it's supposed to do best.
Great. And so certainly we could all understand if you've ever had an accident or an injury, that would make a lot of sense for you. But what I think a lot of people aren't aware of, like you mentioned, babies and kids. Talk about the accident or the trauma that a child might experience, why they should all get checked, and then how does it relate to maybe an athlete who's trying to perform at a high level? Interestingly
enough, sometimes the first subluxation occurs at birth. The birthing process is actually very traumatic, or can be very traumatic. So that's why we say we want to see you when you're very, very young, because if we can clear any interference, you're going to grow and develop the way that you should, and you're going to have a long, vibrant, healthy life. And sometimes some parents don't know this, and so it's my mission to educate and empower those parents to get their kids checked.
Yeah, and I think more parents are becoming aware of that, because you see, if you've ever been born, which of course you have, and you watch the birth process and how the pulling and the twisting very often on the neck or on the lower spine, and you say, well, how does that affect the child? Well, imagine, you would never do this, of course, but imagine pulling your baby along on the floor by their neck or their head, you would never do that. You would never do that. But that's the kind of pressure that that is put on a baby's neck. And so why wait 20 or 30 years to have that child develop arthritis, neurological conditions?
Migraines. Developmental problems.
And in a baby, what are some of the ways that it may manifest, including that they may not have any symptoms, but what are some of the ways that it might manifest from a symptomatic perspective?
It could be ear infections, it could be colic, it could be a number of symptoms. Constipation is another one that I see very often in my practice.
Absolutely. I'll never forget the text message I got from a father one time after checking the baby. It was like, holy crap, because the baby had been constipated for a long time, and then all of a sudden got the nervous system freed up and the digestion started working properly. And so
I had a mom call me the other day, and she said, she brought in the baby because the baby wasn't doing well. It wasn't sleeping at night. It was very, very fussy. And she brought the baby in because another patient of mine referred her over to the practice. And so I adjusted the baby a couple of times, and she calls me. She says, I don't know what you did, but this baby is sleeping, and now she's sleeping too much, and I don't know what to do.
She had some catching up to do.
Yeah, exactly. She's healing. This is a good thing.
That's awesome. Very cool. And so how about an athlete?
Oh, we see tons of those. I mean, any athlete.
I remember you sent me that picture one time of the NFL player that you were with holding the 100-year lifestyle.
Exactly. Yeah, Mr. Santana Moss.
There you go.
He's a great athlete. I see
Cool.
his family as well. It's
Awesome.
So we see a lot of athletes, and that professional athletes, any athlete really, puts their body through rigorous training. They take NFL players or football players, any really athlete, but football players take big hits, and so they're more prone to becoming injured and not performing at optimal levels. So when I work with an athlete, we want to make sure that there's no interference in that nervous system, that their structure is completely balanced, so that they can go out there and perform at 100%.
Yeah, and it makes them, not only gives them the extra edge, and you don't have to be a pro athlete. I mean, there's a lot of, I took care of, like you do, young soccer players and baseball players, and just wanting to get maximum swing and wanting to get maximum power and heal quickly, of course.
Yep.
All of those. And so the average everyday athlete that's walking and jogging and running, what about those people?
Oh yeah, those people too. They need it just as much. And it's not this is not a luxury. This is a necessity. Chiropractic is a necessity. Some people say, oh no, that's just for athletes or for wealthy people. That's not true. I mean, you need to have this as part of your plan.
Yes, and when you say it's an important aspect and it's not just a luxury, I think it's very important, and kind of that circles us around to why 100-year lifestyle. I mean, listen, we're in a culture that we are living longer than ever.
Yes.
We have a generation of people, maybe you at home, maybe you have aging parents or grandparents who have been suffering in their longevity. They didn't know they were going to live this long, so they didn't know how to take care of themselves. How important is it to have a healthy spine and nervous system, especially as you age, to get to it early like we've already talked about, but then to also keep it healthy as you age?
Well, it's really important because you don't want to be a burden on your kids, your grandkids, your significant other. And if you don't have a healthy spine, you're full of arthritis, you have nerve tissue deterioration or atrophy of the nerves, you're just not going to function at 100%. You're not going to be able to do the things that you want to do with the same ability that you're able to do when you were 20, 30, or even 40, right? So it's important that as you age, you protect yourself.
Absolutely, and you don't want to lose it and then try and get it back. That's what so many of this, if it ain't broke, don't fix it generation has done, and they have learned, unfortunately, the hard way. You and I are getting the advance notice that our parents and grandparents never received. So making good choices, watching this video, seeing South Florida Chiropractic Rehabilitation and Wellness is a great option.
I always say an ounce of prevention is worth more than a pound of cure.
Way more.
Absolutely.
Yes. And so closing thoughts.
Well, it's important for me as well as it is for you to educate and empower the community, the world, about chiropractic and the benefits of chiropractic. And that's what I strive to do every single day in my practice. And I am very fortunate and lucky to be able to help as many people as we help every single day.
Well, we're fortunate to have you as a part of our family and a part of our team. And, when we have people that need care down in South Florida, that's where we send them.
Yes.
And so thank you for representing so well and for caring so much about the people in your community. You're doing a great job.
Thank you.
Thanks for watching, everybody.